Welcome to the fascinating world of neuroimmunology. It is a field that explores how two of the most complex systems in our body, the nervous system and the immune system, work together to protect us and maintain balance. From fighting infection to influencing behavior, neuroimmunology holds the key understanding of health and disease. Your brain and immune system might seem separate, but they talk to each other all the time. Let's explore the fascinating science behind it. Neuroimmunology is a branch of science that studies the connection between brains and the immune system. While the nervous system uses electrical and chemical signals to control function, the immune system defends the body against pathogen using specialized cells and molecules. This system communicates constantly.
Let me introduce you to our immune cells that reside in our brain, microglia. They are known as the janitor, nurses, doctors, paramedics, police, and executioner. Microglia acts as a first responder to whatever is happening in our brain. They identify and destroy harmful invaders while also cleaning up damaged neurons and debris. But if they overreact, they can cause inflammation linked to a disease like Alzheimer's. Meanwhile, the brain also has a unique protective shield called the blood-brain barrier. This barrier prevents most pathogens and toxins from entering the brain but allows essential nutrients to pass through. However, when the barrier is compromised, it can lead to severe consequences such as neuroinflammation.
Multiple sclerosis, or also known as MS, is a chronic autoimmune disease where the immune system mistakenly attacks the central nervous system, damaging the protective covering of nerve called myelin sheath. This process, known as demyelination, disrupts the flow of electrical signals between the brain and body.
Have you ever wondered how it attacks myelin sheath?
First off, let's start to know myelin function. Myelin is an insulating layer that wraps around nerve fibers in the brain and spinal cord, allowing electrical signal to travel quickly and efficiently. Think of it like the rubber coating on a power cable. It ensures smooth transmission of energy. In MS, the immune system, which normally protects us from infection, suddenly becomes confused. It begins to attack the myelin sheath as if it were a harmful invader.
Once inside the central nervous system, it has a blood-brain barrier. These cells identify myelin as a target. They release inflammatory chemicals signaling other immune cells like B cell and macrophage to join the attack. These cells produce antibody which stick to the myelin, that marking it for the destruction. Macrophage engulf and degrade the myelin, exposing the nerve fiber underneath. As the myelin is destroyed, electrical signals traveling along the nerve fibers slow down or are completely blocked. Over time, the nerve itself may become damaged, causing irreversible disability.
MS is triggered by a combination of genetic factors and environmental factors. When immune cells mistakenly attack myelin, it causes inflammation and scar tissue, known as plaque. This plaque will form in the brain and spinal cord. Over time, this leads to a nerve damage and progressive disability. The disease often starts with a relapsing remitting pattern. Relapsing remitting pattern is when the immune system periodically attacks the protective myelin sheath around the nerves, causing flare-ups of symptoms called relapse. A person will feel fatigue, muscle weakness, and difficulty with coordination, then followed by periods of partial recovery, a remission, where the inflammation subsides and the body repairs some damage. To put it in a simple word, it is when the symptoms like fatigue, vision problems, and muscle weaknesses come and go. In most severe cases, MS becomes progressive, leading to irreversible damage to the neuron.
Unfortunately, there is no cure for multiple sclerosis. These treatment options can help you manage symptoms and slow disease progression. First is immunomodulators. Immunomodulators are drugs like interferon beta and glatiramer acetate that help to reduce immune system activity, decreasing relapses in relapsing remitting MS. Second, monoclonal antibodies. Monoclonal antibodies are therapies like ocrelizumab and natalizumab that target specific immune cells, preventing them from attacking the CNS. Lastly is imaging therapies. Imaging therapies, on the other hand, is a research into neuroprotective strategies aimed to repair myelin and preserve nerve function, offering hope for progressive MS.
Multiple sclerosis demonstrate the power and complexity of neuroimmunology. By understanding how the immune system and nervous system interact, researchers have developed life-changing therapies offering hope to millions of patients. With ongoing research, the future looks brighter, with possibilities for repairing myelin and halting disease progression. Thank you for joining us on this journey into neuroimmunology and MS. Together, science and medicine continue to push boundaries to improve life. Bye-bye.